Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Couple quick updates. Later on this afternoon, we have a very busy afternoon. At 1 o'clock, we'll have Governor Raimondo, excuse me. At 2 o'clock, we'll have Terry Roark from the Naval War College, one of the leading experts in the United States on the Korean Peninsula. Obviously, there's major news coming out of North Korea. And third, at 3 p.m., we'll have Professor Jennifer Lawless from the University of Virginia, one of the leading political scientists in the country. She'll be talking about the Trump White House, Biden's campaign, and everything DC. Let's go to Michael Fine. Dr. Fine, thanks so much for joining us today.
Nice to be here with you.
Let's go to the numbers. Obviously, there's this massive debate emerging in the United States of when we go back to quote normalcy. Georgia's governor has now really unlocked much of the state, all the way down to tattoo parlors, and that's sparking a lot of friction both in that state, but also the debate around the country. What do the numbers tell us here in Rhode Island?
First, in Rhode Island, we are over 5,000 tested cases, about 5,090 tested positives, 5 deaths up till today, 5 new deaths, 155 total deaths, about 300, 320, 30 positives a day. That number has stayed about stable, and that predicts what's going to happen 3 weeks from now in hospitals. Our hospital numbers are slowly creeping up, but slowly. 272 yesterday. ICUs have been stable for a number of days. ICU use at 62 beds, 45 people in the intensive care unit, which means that we are able to function given the extra work. We just don't know yet how much more work will come on top of this. I mean, I think we have the capacity to triple what we're doing now in terms of hospitals. Hopefully we won't need to, but we are still flying under the capacity max. I think that's 3 weeks away, given the constant flow of positives, which have not yet started to diminish. Around the nation, first of all, around the world, 100,000 people have recovered, and that's a big deal, but there are 2.5 million people who have tested positive. The tested positives around the world have dropped off just a little bit, but are staying pretty stable. The tested positives in the United States still growing at 3,000 to 4,000 a day. We're going to pass 800,000 today. 172,000 deaths around the world, growing at about 5,000 or 6,000 a day, most unfortunately. 42,000 deaths in the United States, growing at 1,700 to 1,800 a day on average, a little down from where we were a week ago. We'll see if that continues. To your point about what happens when somebody opens up, you know, we'll wait. I mean, this virus is a fierce and tough taskmaster. Yeah. So we'll know what that means. We'll know what the result of that is 3 to 4 to 5 weeks from now, as the virus is either spread or not. My guess is that when people open now, they will get more cases and more disease. But it's a 3 to 4 week, 3 to 4 weeks away, unless their positivity rate is particularly low.
Dr. Fine, you've talked a lot about concerns in Central Falls and Pawtucket. The numbers we ran was Pawtucket and Central Falls combined are about 8.5% of Rhode Island's population. But the number of cases that have been reported positive are 12.5% of the population. What do those numbers say to you, and what other numbers do you know coming out of that community?
Well, those numbers continue to grow and grow fast. And one of the challenges is there has been relatively little testing in both of those communities. There are 2 sites, each testing about 30 a day, I believe. I know the numbers best from one site, where the one site in Central Falls is testing 5 to 10 people a day from Central Falls.
Yeah.
So we really don't know exactly what's happening. But in that one site, 35% of tests are positive from people in Central Falls. 32% of tests are positive in people in Pawtucket. That's 3 times the state's positivity rate, and that tells me we likely have a little hotspot, unfortunately.
And is there a strategy in place by the state and the community to deal with that hotspot?
Well, the 2 communities have come together and put together a new community-wide intervention called Beat COVID-19, which is they've together stood up an incident command system and really have created this whole community approach to try to get at it. That is just beginning and is ramping up, but I expect that we will have hundreds of people involved in fighting this disease in these 2 communities together. I think the operating thought is that we can't wait for the cavalry. Essentially, we are the cavalry and are going to have to get this done ourselves.
Statewide, we went over 5,000, not a big surprise, not quite at the pace that we were cranking out a little bit ago, but I think yesterday's number of reported cases were either the 2nd or 3rd highest. Where do you see us going over the next week to 10 days?
I think we stay pretty much the way we are. I think we've seen the impact of social distancing, understanding that we're still letting lots of people go out to work. Going back to Central Falls and Pawtucket, what I think is going on in those communities, and I think is likely going on in other lower income communities, is that many people are going out to work. They have to work in settings that are supposed to be letting people spread apart, but I don't know how much that's happening. I think the disease is likely spreading in workplaces, and then people are bringing it home to their densely populated houses and apartments, and then spreading it in housing at home. And that's the real challenge. There's, as I've said before, a substantial lag from the moment somebody is symptomatic until we get them, we get the beginning of contact tracing going. And I know that because in that one testing site in Central Falls, there's a 5 to 7 day lag just for the test report. So that means the disease is spreading. We don't have the opportunity to really take people out of their houses and isolate them until the test comes back positive. And by then, there's spread inside houses. And we heard today of a family of 10 people who are all positive in Central Falls. And we're hearing that again and again and again. I assume that that's happening in South Providence and parts of Cranston and in Woonsocket. I think that's the piece of this spread that we have not yet interrupted. And frankly, that's why we're working so hard in Central Falls and Pawtucket to change this dynamic.
It seems like we're now hitting a new phase. We went from an economic crisis into a health crisis. Now we're going into what I'll call a political crisis. There seems to be some level of conservatives, both around the country, who are calling for the economies to be unlocked. Most Americans, according to polling, about 65 to 70%, believe that the lockdown strategy is the right strategy from a political standpoint, a public policy standpoint. This weekend, there's going to be a rally at the State House of those calling for the state to be unlocked. Are we running into the danger zone now, both here in Rhode Island, and you've seen some of the protests around the country?
Yeah, I think we have an interesting challenge, and this is where people who think that we're on the right path need to speak out as well. This is much like the people who are opposed to vaccination. I get the need for civil liberties, and I don't want to to challenge individual freedom for 1 second, except insofar as it threatens everyone's health. So, if we open too soon, we're going to get more people sick and more people dying. It's as simple as that. And on the other hand, part of the challenge with social distancing is it gives you a strategy for stopping transmission, but it doesn't necessarily give you a strategy for what comes next. What we've effectively done when we lowered the peak, and have done that fantastically, is that we've also broadened the peak. So what would have been over with devastating consequences in 2 to 3 weeks is going to take 8 or 10 or 12 weeks. And that's very hard to bear economically. The tensions are real, but I think this is a moment for Rhode Islanders and for Americans to start talking to each other instead of yelling at each other and yelling past each other, because that's where we get into political problems instead of figure out how to work this out together as one people.
Well, listen, it's arguable the country's never been as divided either since the 1970s, early 1970s, or the 1860s, depending on your perspective. And it is an election year, and there's a great divide. What more can science, physicians like yourself, do? Is it just keep the information flowing and make sure that you're developing the best possible strategies? Is that the way to curtail some of the folks who want, and for good reason, want the economy to restart because they're hurting economically, they're laying off workers, they've been laid off, etc.?
Yeah, no, I think our first job is to do what Dr. Fauci is doing, which is, tell people the truth, the unvarnished truth. Let people understand the consequences of each choice. And have the data they need to make good decisions, and so that we all have data to make, and the data we need to make good public policy decisions, and then also to do what everyone's burning the midnight oil trying to do, which is find a vaccine and find a treatment, because that's the way out of this. Not so much, kind of one political position or another. At the end of the day, we solve this when we attack the virus and not each other.
Based on the numbers you see it, do you think, do you agree with the governor that sort of last week of April, first week in May looks like the height of the number of cases, and then we can see what transpires from there and how downward a slope we realize?
Yeah, I think somewhere in that first 2 weeks of May is where we're going to get to our relative peak. But our peak isn't a mountain, our peak is a hill. And what I don't know yet is whether it's a hill or whether it's a plateau. I suspect that what we're going to get is more like a plateau, where we may double or triple our number of people in the hospital and then stay at that level for a number of weeks, 4, 5, 6, 7, 8 weeks. Not a quick up and down, but time will tell. And I actually think a lot depends on what's happening in our most at-risk communities, because even if social distancing is doing what we needed to do, sort of in the more suburban communities, if we use it to slow transmission there where we really can, our most at-risk communities, I think, are going to peak and peak high, and that may eclipse the good work that's been done by social distancing as a whole. It may be where we look back and say, we get the importance of keeping the economy open, but having people go out to work every day may have tipped the boat a little bit in a way we weren't anticipating. Time will tell.
This crisis has exposed many of our frailties as a country, and especially here in Rhode Island. Outdated technology at DLT, the lack of diversity of our economic structure, so many tied to retail and hospitality. When you talk about Central Falls and Pawtucket and other areas of the state, does it also really expose how disconnected and unaligned we are from a communication standpoint between our newer residents, first generation Latinos, and the rest of the community?
Well, I think that's the opportunity. You know, I've always seen this opportunity, this state as this amazing mosaic of communities. And what we can do together is really about bringing those communities together, getting them to talk to each other, because these communities have huge amounts in common, and then getting them connected to what happens on Smith Hill, which often doesn't quite understand who's out there and who their constituents really are. But you know, I dream about the places we can go together if we can get all that done. You know, think about it. As a center for international business, we have the speakers of many languages. We have many cultures with huge entrepreneurial energy at the community level, not like fancy high-tech stuff, but people who are working to figure stuff out for their own communities. And then those communities are usually part of diasporas in the rest of the country. You know, there are lots of opportunities that we've never tapped, but we can tap if we think about us as one state, one people connected to each other.
Last word to you, Dr. Fine. What do we need to do to get through this?
Keep doing what we're doing. Just keep doing what we're doing. You know, watch and make sure that anyone who has a symptom goes into a room by themselves that moment. Don't wait 3 days to see if it's going to go away. You know, try to deal with your own denial about maybe it is, maybe it's not. For the moment, say that it is. Go right into a room by yourself, close the door, and don't plan to come out for 7 to 10 days. Talk to your physician, you know, get a test, but mostly get yourself into isolation right away so you don't spread this disease to other people.
Dr. Michael Fine, thank you so much. Please stay safe. For everyone else, 1 o'clock, Governor Raimondo's briefing. 2 o'clock, Terry Rohrig, professor at the Naval War College, on what's going on the Korean Peninsula, especially potentially regime change, leadership change in North Korea, which would be on any other given day the biggest news in the world. Now it's got to compete with tumbling oil markets and everything else. And then at 3 o'clock, Jennifer Lawless from the University of Virginia. Thank you, everybody. Stay safe.
Thanks, Josh.